Do you really need every single medication that you are on? Do you need all of the prescriptions you are on? The answer might be yes, but it's worth evaluating if it's possible to deprescribe some of your prescriptions. And this video is not telling you to stop your prescriptions on your own at all, but it's to give you tools and to make you feel confident going in and just double checking and evaluating with your in-person physician if every single prescription needs to be continued and if it needs to be at the strength that it is at. And the reason I'm making this video in a hotel room is I just had the pleasure of watching Dr. Patel speak on this very topic. He was a phenomenal speaker. I probably attend, 5 or 6 medical conferences a year, and each one, maybe I listen to 10 or more speakers. And so that's about 500 speakers a year. Yeah, that's over 12,000 speakers in my medical career of 2 decades, more than 2 decades. And he is probably one of the top 10 presenters I've ever listened to. So in the end, I'm going to give you his resources, and I'm going to give you questions that he suggested we go in and speak with our primary care physicians about, so that we can just really evaluate that we really need to be on what we're on. And the reason is this: people are on 10 medications, 20 medications, 30 medications, and there's no stopping point for them. So generally, they just are accumulating over a lifetime. And actually, the adverse reactions, not just from one drug interacting with another drug, but 10 drugs interacting with the 11th, or 25 drugs interacting with the 26th, and then the body aging. And as the body ages, our water composition changes, our fat percentage changes, our muscle mass changes. Not only that, but our liver function changes, and our kidney function changes, and our cognitive function changes. So the body's ability to metabolize medications changes. And because of side effect and side effect profiles, we're no longer assured that a medication that's in a patient's best interest when we prescribe it is actually improving quality of life as they continue on it. And it's worth reevaluating. In fact, I'd say it's very important to reevaluate. Did you know adverse drug interactions cause a death every 5 minutes just in the United States alone? So again, it's the 4th leading cause of death. So here are the 5 questions that Dr. Patel suggests, and write this down, that you go in to your primary care physician or your prescribing physician and all your prescribers, and to repeat these questions with each one of them, and also to bring all of your prescriptions in a bag or have them all clearly written. All of the prescriptions you have, because there is a lack of communication between different specialists if you see more than one physician. So make sure they're all aware of your entire list, and then ask this. The first question is, why am I taking it? And the physician will be able to tell you why, and then you might be able to verbalize to them, that's no longer an issue for me, or I don't need that, or actually that issue's worse, and maybe it'll help you reevaluate. Maybe you need that medication, maybe you need to be titrated up or down, or maybe you even need another medication that would work better. But this allows the dialogue to start as to why I'm even taking this, and is it doing what it's intended to do? The second question is, what are the side effects of it? Because if you know that the side effects is sleepiness, but you also hear that about 5 other medications you might really want to look at, that's why I'm groggy, that's why I'm addicted to caffeine, or that's why I'm having trouble recalling things. And maybe it is an age-related cognitive change. Maybe it's polypharmacy causing this grogginess, this overall feeling of, and maybe I'm not actually, and instead of starting an antidepressant, maybe I need to try titrating down some of these medications that are causing this extreme side effect, because this side effect alone is significantly impacting my health and my life more than the original reason that they were prescribed. So it's really worth looking at, why am I on it and what are the side effects of it, and really writing them all down for every medication you're on so that you can see the cumulative effect. So the third question is, if a doctor changes your dose, you always want to ask, why are you changing my dose? You want to know. So for the example he gave, and this is a very real life example, is a physician was upping the dose of a hypertension medication, a high blood pressure medication. And if the patient would have asked, why are you changing this dose? And the physician said, well, because your blood pressure is not controlled, it's XYZ, the reading. Then that gives the patient a minute to say, oh, except that for the past 3 days, I actually forgot to take this. So the healthy response is, oh, okay, take your medication, and then let's have you in and reevaluate your blood pressure again. Take it for a week, and then let's come back in and just take 2 seconds to just check your blood pressure. instead of upping a dose or adding on a whole nother hypertensive medication that when they're home and actually taking their medication is going to drop their blood pressure too much, and or even if it doesn't drop their blood pressure too much, is now adding a whole nother layer of side effects and drug-to-drug interactions. So if a dose is changing, a pain medication, a hypertension medication, any medication, ask why and double check that the reason that they're changing the dose actually reflects need, as opposed to maybe you just missed a dose that day and maybe it just needs to be taken as originally intended as opposed to amped up. There's a lot of different medications that are meant to be taken short term. So the fourth question to ask is, what is the end date for this prescription? Many people are on medications that they do not need to be on. And so that, just going off of one medication, decreases your drug-to-drug interactions and your risk, which is always a good thing. So you might not be able to discontinue any of your medications, but it's definitely worth asking, is there an end date to this prescription, or do you expect me to be on this the rest of my life? And if you expect me to be on this the rest of my life, is there ever going to be a need for it to change over time? Because as someone ages, again, their ability to metabolize the medication, their ability to eliminate the medication, or even the need for the strength of the medication may change as their body mass and their bone density and their water and their muscle mass and their gut metabolism, their liver metabolism, and their kidney function. As all of this changes, it's worth reevaluating the strength of it. So it's worth knowing if you're supposed to be on it the rest of your life or if it's a short-term medication. And it's also worth asking, will there be a time when this dosing needs to be reevaluated? The last question is sort of obvious, but it's worth asking is it possible to ever discontinue this? So even if they say, yeah, I anticipate you'll probably be on this the rest of your life, just for information, would it ever be possible to discontinue it? If I try this antidepressant, is it possible to discontinue it? They might say, in this case, no, I don't think that's a good idea. Or they might say, yeah, let's try it for 6 months and then we can cut the dose in half, or we can see, we'll reevaluate. Or they might say, let's wait 3 months, or they might say, let's wait 2 years because I know you're in this transition. But yeah, it's very possible that what we could do instead at that point is treat you with better sleep, or treat you with, nutritionally, or maybe we'll do a short trial while you go to therapy, or whatever it is. Is it possible? Is there any world where this medication could be discontinued? So deprescribing, to go with your physician and all your physicians, not just your primary care physician, but any specialist that you go to, and just going through the list of medications and letting them be aware of all of the medications you're prescribed from all of your prescribers. And then again, it's just those 5 simple questions. It's not offensive. It's your right to know. It's your health. It's your body. And then it allows you to have some conversation about, that's interesting that we're treating a sprained ankle that I had 3 years ago, when actually my ankle is not bothering me anymore. Or maybe it is, but I'd rather try physical therapy, because what I'm realizing is that the side effect of this medication is lethargy, and I've actually been feeling very unmotivated, and it's making me depressed. And maybe if I stop that and treat my ankle in a different way, I'll actually feel better. So, or a prescription that was meant for something that is now over or resolved, or a prescription that isn't resolved, but the side effects aren't worth it, or the drug interactions aren't worth it, and people had no idea one specialist did not have any idea how many other medications you were on from another specialist. And again, it's not something light like, oh, just, there might be some kind of esoteric risk. We're talking about drug-to-drug interactions being one of the leading causes of death in our country. And you can have a long, healthy, vibrant life on a lot of medications. But if we can minimize those because we realize that the side effect and the risk of drug interactions is outweighing the reason we were on it in the first place, then that is definitely worth a conversation. It's worth a visit to your in-person physician for sure. And I want to plug Dr. Patel and his book, because I was so impressed with his ability to speak, the energy and the presence he brought, and all of the points, the food for thought that he gave. And the book he just published is called Age is Just a Number. And I am excited to read it. I just picked it up today at his lecture. I'm excited to read it, and I just thought I'd give it a shout out because I'm a huge fan already of absolutely every word that came out of his mouth, so I'm really excited to dive into reading this book. Everyone's goal, I would like to hope and think, is to really help the patient feel their very best. And that's the only reason you ever prescribe something in the first place. But as it accumulates, unfortunately, so do the side effects, so do the risk, so does the toxicity. And then on top of that, we take a body that then starts to age, and that really ramps up the possibility of drug-to-drug interactions and having a bad and even fatal outcome from it. So it was a food for thought today, and I hope you found this video helpful.